Wisp Sports Radio, the voice of women in sport.
Hello, and welcome to episode 8 of Ready, Steady, Rehab on Wisp Sports Radio, where we believe that women in sport deserve equal coverage. Ready, Steady, Rehab is about sports injuries, what can cause them, the symptoms to look out for, and of course the rehabilitation process.
Wisp Sports Radio is brought to you by Highlands Earache Drops.
Have you been diagnosed with an earache by a physician? For natural relief due to earache pain, fever, irritability, and sleeplessness, try Highlands Homeopathic Earache Drops and Tablets. Highlands has been trusted for generations to provide safe, effective homeopathic medicines for all members of the family. There's no alcohol and no sting. You can get back to doing what you love. Go to highlands.com/ear-pain to find a retailer near you. That's highlands.com/ear-pain. Claims are based on traditional homeopathic practice, not accepted medical evidence. Not FDA evaluated. Read and follow label directions.
When I told you I was going to give you advice.
Welcome to the show. I'm Dr. Heather North, Doctor of Physical Therapy. And on today's episode, we're going to be talking a little bit about dry needling, when you use it, how it works, and how you can utilize the treatment to help your recovery process. So we get a lot of questions in the physical therapy world about what exactly is dry needling and how it's actually different from acupuncture. So something to really remember is that acupuncture is basically an essential part of traditional Chinese medicine. So it's based on ideas and theories that were created over 1,000 years ago. Acupuncture is basically where you insert fine needles into specific sites of the body, and those specific sites are really chosen according to the principles of traditional Oriental medicine. So keep in mind that this is a system of ancient Chinese medicine that is over 2,500 years old. So the explanation of how Chinese medicine and acupuncture works is basically that there are channels or meridians of energy that run in patterns throughout the body and over its surface. And so these channels flow through the body to basically irrigate and nourish the tissues and organs. Any type of obstruction in the movement of this energy or in the meridians, it's like a dam that can cause obstruction in the flow of blood, body fluids, metabolic waste, and it can create these imbalances in the body. The belief is really that by inserting acupuncture needles into the acupuncture points, you can influence the meridians by unblocking these obstructions, basically leading to healthy flow through them. So it's really important to understand that this is an idea of improved energy flow and biochemical balance. And again, this is something that was really established, thousands of years ago. I love encouraging patients to get acupuncture to help with pain and discomfort, especially for back pain, for headaches. But again, the ideas behind acupuncture aren't really all that well understood or explained by science. But it's also really important that dry needling, we also don't understand exactly why it works. There's a lot of research that's currently being done. So dry needling, it's sometimes referred to as clinical or Western acupuncture. We refer to it a lot as biomedical acupuncture or biomedical needling. And it is an evidence-based type of medical treatment. And it's where we use a solid filament, sort of like a fine filament needle. It's introduced into the skin. And it's such a funny word because dry needling really basically means that it is not a wet needle. A wet needle is a hypodermic needle, so something that you're going to inject with. A dry needle is something that does not have a hole in it, so it's a solid needle. So dry needling is it's a really unique procedure that it's intended to specifically target and restore muscle function. And really the emphasis is on improving tissue healing and restoring normal tissue function. This is really important as continued activity with poor muscle function can really lead to, further muscle damage and tissue damage, and even increased pain. So dry needling really is not meant to replace any, of our conventional medical procedures, such as physical therapy, surgery, things like that. So however, when it's really combined with, a lot of conventional treatments, like things like manual therapy that we'll do at the clinic, it can really be quite an influential method to accelerate pain reduction. So it also can help with the healing process and the restoration of normal tissue function. So again, kind of getting into a little bit of the science, there's a lot of evidence that supports the positive effect of inserting needles. And these needles have effects on the electrical and chemical communications that take place in our nervous system. So modern dry needling is really based on current medical science and research known and accepted by today's primary care, orthopedic, neurologic, and pain management physicians. However, the positive effect on pain, inserting that needle, it's a really, really difficult thing to kind of describe and completely understand. And there's a couple of different ideas on how this all works. So the first theory is really that if something is causing pain and it happens enough, or if the trauma is great enough, the pain signal may return and activate special pain receptors, which will basically feed back to the spinal cord. And this will cause pain to continue instead of fade, and it's basically called a reflex arc. So number two, at the same time, motor neurons may become stuck in this kind of like feedback loop, which facilitates muscle spasms. And in some cases, the reflex arc continues for years, decades, and it becomes something that's really difficult to stop. So basically, by introducing a new stimulus, which is really here the fine filament needle, it will kind of stop that reflex arc, and it has the effect of relaxing the muscle. Okay, so the second theory is that a muscle is basically in constant spasm and becomes damaged. So again, if a muscle is contracting a whole bunch, it's going to have some damage to it. So these spasms don't allow blood flow to get into the muscle. It basically means less oxygen and nutrients into the muscle. And there's a lot of research right now that is showing that decreased blood flow to nerves even in the back can increase pain and cause a lot of issues. So with this kind of lack of oxygen, muscle fibers can kind of die off and they get replaced by kind of scar tissue, which is basically just a collagen or really stiff connective tissue, which makes everything feel really thickened. And this basically in turn kind of keeps the muscle in this really tense, hard position, and it causes those continued spasms and discomfort. So when you put that needle into the trigger point, which again, these trigger points are research-based points in the muscle that are affected by stimulation, and basically the muscle causes the muscle to relax. So there are also other ways in which we use dry needling. We can actually create microtrauma in the connective tissue. So for example, if I see a patient with Achilles tendonitis, we are going to create lots of little bits of microtrauma in the tissue. So putting lots of little holes basically in the Achilles tendon. And what happens again here is that you're drawing in blood flow, you're creating an inflammatory response. And this is kind of an idea that's used in other types of medicine. So, prolotherapy, which is an injection of sugar, not done by a physical therapist, but done by a medical doctor. And this injection of sugar can actually cause, again, this inflammatory response. So we're really finding that inflammation is not necessarily a bad thing. So, and this kind of walks us into probably a different topic that we'll discuss, in other episodes. But again, that's another really great way. And I use that quite a bit. So things like, tennis elbow, Achilles tendonitis, patellar tendonitis, biceps tendonitis, all these things can respond really well to both stimulating the muscle to kind of get the discomfort to stop, but also getting the actual connective tissue to heal and regenerate. So, a couple of questions that I get a lot from patients, is this safe? And there are a lot of misnomers in the medical world right now. So, doctors of physical therapy, we have basically 9 semesters of post-undergrad education. It's a ton of hours, really intense anatomy, physiology, palpation, differential diagnosis, the list goes on and on. So the education itself for dry needling is really just about how to insert a needle. These are fairly short courses. This isn't a difficult task to do because we already have all that education backing up where to put the needles, what we're trying to affect, what those trigger points are. So again, this is just like safe needle procedure, how to sterilize the tissue, how to discard of needles. And of course, there's also a lot of emphasis on, preventing any trauma to the body like pneumothorax. So that's something that a lot of patients get really concerned about. So evidence really shows that, the incidence of pneumothorax, which is basically a punctured lung, is about equal between acupuncturists and physical therapists, chiropractors, medical doctors. So if you know your anatomy, this shouldn't even be a problem. Make sure you see a physical therapist that you trust, that has a lot of experience, things like that. So same with, chiropractors, medical doctors. So it's really safe. Sometimes you can have some bruising, things like that. That's all really normal. And again, that whole inflammatory process that we're trying to create, that's actually a good thing. So what does this actually feel like? So it is a tiny little poke as the needle goes to the skin. Sometimes those tiny little pokes can be a little more uncomfortable in different areas, dependent on sensitivity of the tissue, like feet and hands, or if you hit kind of a hair pore dead on, which we have like hair pores all over our body, there's lots of nerve endings in that area. So that can be a little uncomfortable as we get into the muscle, deeper into tissue, especially if it's damaged, that can be painful. The main thing is, of course, to relax. This can sometimes be compared to, getting tattoo work done or deep acupuncture, much deeper than, just surface level acupuncture. But again, it's really up to you how comfortable you feel. There's lots of other things that we have as doctors of physical therapy in our bag of tricks. So kind of keep that in mind. And also in a lot of states, it's not part of the Practice Act. Here in Colorado, where my clinic is located, it's been part of the Practice Act basically for 10 years. And it has recently been completely established in our Practice Act within the state. And we're really happy about that. So, okay. So you have an injury and you think that dry needling might help. Just make sure that it isn't just dry needling that you're accessing, that you're working with a physical therapist that uses kind of a combination of modalities, and that the dry needling is really focused around what type of injury you have. So I wouldn't feel worried or scared. This is really something that can make a big difference. I don't really use dry needling in kind of a solitary treatment for patients. Again, I always incorporate in other things, but I've had really good success. So hopefully this kind of explains a little bit about the differences between dry needling, acupuncture, and how it works.
Conversations from the world of women's sports. This is Wisp Sports Radio.
If you'd like more information, please visit my website at redhammerrehab.com, and it's provided in the show notes as usual, so you can email info@wispsports.com with any questions you might have about sports injuries. In the next episode, we're going to be addressing that kind of topic of posture and how to back our way out of kind of the traditional American sedentary lifestyle. So there's going to also be some links in the show notes accompanying this episode at wispsports.com. So just go to listen and click on Ready, Steady, Rehab. And for more conversations from the world of women's sports, please visit wispsports.com and subscribe to Wisp Sports Radio on your podcast player. You can also post your comments and share on social media. So just look out for @RedHammerRehab and @WispSports. Thanks again for listening and supporting women in sports.
When I told you I was gonna give you advice.
Thank thank you to our brand sponsors at Wisp Sports Radio. Please visit them at highlands.com/ear-pain.